Hello everyone, I am Dr. Vishal Khullar. I am a cardiac surgeon. Today we'll discuss about aortic aneurysm and aortic dissections. So, three parts of the aorta. Actually, the part within the heart is called as root of the aorta. It contains the aortic valve and the origin of the coronary arteries. The second part is the ascending aorta, which goes vertically upwards inside the chest. Then it's the aortic arch, the second part, which gives rise to the head and neck vessels, right innominate artery, left carotid and left subclavian. And then after the arch, we have the descending aorta, which goes almost vertically down. An aortic aneurysm can be described as an enlargement of the part of the aorta or a dilatation. So it can involve any part of the aorta starting from the root. The root itself can get aneurysmal, or the ascending aorta can get dilated. Sometimes the arch can get dilated, and then the descending thoracic aorta can also get dilated. The risk factors are uncontrolled high blood pressure, smoking history, a genetic history, a family history of aortic aneurysms or dissections, which means patient can have history of sudden death in the family. And then we have connective tissue disorders. Aortic aneurysm can happen due to trauma or infection. If a patient is having symptoms due to an aortic aneurysm, that means it's an advanced stage. Those symptoms can be, shortness of breath. Sometimes with the inflammatory diseases of the aorta, you can have some kind of a vague chest pain, or you can have hoarseness of voice. Most of the cases of aortic aneurysms are asymptomatic. So the aorta will keep on enlarging, but patient will not have any symptoms. At some point, the aorta gets so much bigger that there is a tendency to either rupture or it can dissect. An aneurysm is just an enlargement of any part of the aorta, but a dissection means that there is a rent, a tear in the innermost layer of the aorta, and the blood then goes into the media. It dissects the aorta. If you take a transverse section of the aorta, these are the three layers: intima, then we have media, and then we have adventitia, the outermost and the strongest layer of the aorta. So what happens when there is dissection? The intima gets torn. Once the intima is torn, this is what happens. The blood inside the lumen of the aorta dissects into the layer of the media. So what happens? The aorta dissects. This is the blood, a rent in the ascending aorta in the intima. This is how the aorta dissects. So what happens is, dissection can involve the aortic root. It can involve the head vessels, the vessels which give blood supply to the brain. And due to dissection, the blood can travel all the way down to the limbs. So what will happen? A patient can have heart attacks because the root has aortic valve and the coronary arteries. The aortic valve will start prolapsing, resulting in leakage of blood back to the heart. Or patient can become unconscious. Patient can have a stroke because it dissects through the head vessels. In the descending thoracic aorta, patient can have paraplegia, loss of blood supply to the spinal cord, loss of blood supply to the limbs, to the lower limbs because of the dissection. Let's discuss about the treatment. An aortic aneurysm involving the root of the aorta, we need to replace the aortic root, which means that replacement of the aortic valve and reimplantation of the coronary button. Sometimes it may be possible to repair the aortic valve. If the aneurysm involves the ascending aorta, then the treatment is to replace this part of the aorta with a prosthetic graft. It's a graft made up of fabric. If the aneurysm involves the arch of the aorta, then the treatment is replacement of the aortic arch. You can replace it partially, it's called hemi-arch replacement, or a complete replacement of the arch, which is called total arch replacement. Now, as a surgeon, when I see a patient of aortic aneurysms, two things comes to my mind. First is bleeding, how to tackle the bleeding, and the second thing is how do you protect the brain and the spinal cord.